Department of Health is tracking a spike in overdoses in Woonsocket over the last few weeks. Yesterday, the department convened a group of close to 70 people, including city leaders and first responders, to talk about what's causing the increase and what can be done. Eyewitness News reporter Kim Kalunian joins us now with what she's learned new at 6. Kim?
Well, Shannon, in cases like this one, sometimes the reason behind a spike of overdoses is a bad batch of drugs. Health officials say people might think they're taking one thing when really it's something else. A rash of non-fatal drug overdoses in Woonsocket has state officials on alert. The Department of Health convening a meeting Tuesday afternoon to talk about what's causing the unusual number of overdoses in the city.
I think sometimes it's just that simple. That you don't always know what you're getting from your drug dealer. They're not a pharmacy.
Dr. Jim McDonald is the department's medical director. He helps to track the number of overdoses in various parts of the state each week. Rhode Island hospitals are required to tell the state about any overdoses they treat within 48 hours, meaning the department can alert local communities about trends in overdoses in close to real time.
I think this is the trend for the future. Public health has to be responsive, has to be agile, and has to move quickly. Because really, the people in our community don't want to read about what happened a year from now in some stodgy textbook. What city leaders and community leaders want to know is what happened last week and what can we do to prevent tomorrow from being a worse day than yesterday.
And the department has been using this data to alert communities about spikes in overdoses for several years now. To learn more about the process and to find out if your communities most often see spikes in overdoses, you can head to our website right now, WPRI.com. Live in studio, I'm Kim Kalunian, Eyewitness News.